A very good evening to all of you. Today we are going to do the MCQ challenge of pediatrics. Pediatrics is a very interesting as well as very scoring subject as far as NEET PG exam is concerned. So let us begin with the first question. Which epileptic syndrome is associated with left hemispheric atrophy in child? A. Dravet syndrome, B. West syndrome, C. Lennox-Gastaut syndrome, D. Dike-Davidson-Mason syndrome. What do you think is the correct answer here? Which epileptic syndrome is associated with left hemispheric atrophy in a child? A. Dravet syndrome, B. West syndrome, C. Lennox-Gastaut syndrome, D. Dike-Davidson-Mason syndrome. All the options are epileptic syndromes. What happens in Dike-Davidson-Mason syndrome? There is childhood cerebral hemiatrophy. Hemiatrophy or hypoplasia of unilateral cerebral hemisphere resulting from CNS insult in the fetal or early childhood period with compensatory ipsilateral calvarial hypertrophy. This insult could be vascular, it could be congenital or acquired ischemic disease. It could be trauma or inflammation. In utero gestational vascular occlusion involving middle cerebral vascular territory or coarctation of mid aortic arch may decrease the carotid arterial flow. So the correct answer here is Dike Davidson Mason syndrome. So what happens in Dike Davidson Mason syndrome? There is hemiatrophy, hypoplasia of unilateral cerebral hemisphere. It could be as a result of CNS insult, either in the fetal or early childhood period. There could be compensatory ipsilateral calvarial hypertrophy. This insult could be vascular, congenital, or acquired ischemic disease. There could be trauma or inflammation. In utero gestational vascular occlusion involving middle cerebral vascular territory or coarctation of mid aortic arch may decrease the carotid arterial flow. So the correct answer here is Dike Davidson Mason syndrome. A 5-year-old boy has recurrent infections, low platelet count, and rash, as shown below. What is the likely diagnosis? A. Severe combined immunodeficiency. Option B is Jobs syndrome. C. Bretton's agammaglobulinemia. D. Wiskott-Aldrich syndrome. There is an eczematous rash. There is thrombocytopenia. There is immunodeficiency. Eczematous rash, thrombocytopenia, immunodeficiency. These are the features of Wiskott-Aldrich syndrome. Wiskott-Aldrich syndrome is an X-linked recessive disorder. It is due to the mutation of WAS gene mutation on chromosome XP11. So the correct answer here is it is Wiskott-Aldrich syndrome, that is D. Let's move to the next question. Which of the following scoring is done to assess respiratory distress in neonate? It could be Crib score, B. Apgar score, C. Silverman Anderson score, and D. SNAP score. Now let us look at the scores one by one. Crib score is clinical risk index for babies score. Crib score is clinical risk index for babies score. It is a tool for assessing initial neonatal risk and comparing performance of neonatal intensive care units. CRIB-2 score is a validated measure of initial mortality risk and illness severity within 1 hour of admission. It takes into account the birth weight, the gestational age, body temperature, base excess, and sex of baby to determine the initial mortality risk. Then SNAP score. SNAP score's full form is Score for Neonatal Acute Physiology. SNAP score. It was developed by Richardson et al. In 1993 for babies of all birth weights and validated as predictor of mortality, morbidity. It is a physiology-based score that uses 34 routinely available vital signs and laboratory tests. Then Silverman-Anderson score. Silverman-Anderson score is used to quantify the respiratory distress in preterm neonates. So the correct answer here is C. Silverman-Anderson's score. Please click the link in the description box to join the Ultimate Neet PG Masterclass. It is a breakthrough blueprint masterclass. It is a 2-day class which covers all the 19 subjects in a holistic manner. The first 10 people who click the link in the description box will get the masterclass absolutely free. Which of the following genes is implicated in pathogenesis of juvenile myoclonic epilepsy? A. FMR1, B. Fibrinogen1, and C. CHYNN1, and D. GABRA1. This juvenile myoclonic epilepsy has been linked to mutation in many genes, which include CACNB4, CLNC2, EJM234567, GABRA1, GABRA-D, and myoclonin-1 and EFHC1. Once more, juvenile myoclonic epilepsy has been linked to mutation in many genes including CACNB4, CLNC2, EJM2, 3, 4, 5, 6, 7, 9, GABRA1, GABRA-D, and myoclonin-1 and EFHC1. So the correct answer here is GABRA1. True about Fragile X syndrome is A. Triple nucleotide CAG sequence mutation, B. 10% female carriers mentally retarded, C. Males have IQ 20 to 40, D. Gain of function mutation. This triple nucleotide CAG sequence mutation are seen in Fragile X syndrome. The first statement is false because in Fragile X syndrome, you will see CGG repeats, not CAG sequence. Second statement is 10% female carriers mentally retarded. It is also false because mental impairment with retarded or borderline IQ occurs in 35% of carriers. C. Males have IQ of 20 to 40. It is true because the males usually have in this condition in Fragile X syndrome the IQ is mean IQ is 42. IQ is higher if significant residual FMRP is produced. In gain of function mutation, no, there is a loss of function mutation. So the correct answer here is C. Males have IQ of 20 to 40 in this condition. In which of the following disease these X-ray findings are seen? A. Gaucher's disease, B. Fabry disease, C. Markey disease, D. Niemann-Pick disease. Here you can see a peg-shaped metacarpal and rounded vertebral bodies. Peg-shaped metacarpal and rounded vertebral bodies with anterior beaking. There is a anterior beaking is seen, and this is seen in Markey disease. In which of the following diseases the skin rash shown in the picture is usually seen? A. Multiple carboxylase deficiency, B. Biotinase deficiency, C. Alkaptonuria, D. Heart nerve disorder. The characteristic skin lesion you see on the neck is known as the Casal's necklace. And this Casal's necklace is seen in pellagra, that is niacin deficiency and Hartnup disorder. An 8-day-old neonate presented with hypoglycemia, that is glucose is 17 milligram percent, and jaundice is there, and it is diagnosed to have a metabolic disorder. Most likely diagnosis is there is hypoglycemia, jaundice, and there is after the initiation of breastfeeding suggests a diagnosis of galactosemia. The four options are A. Hypothyroidism, B. Galactosemia, C. Glycogen storage disease, D. Fatty acid oxidation defect. So the correct answer here is B. Galactosemia. Please click the link in the description box to join the ultimate 2-day Neet PG Breakthrough Blueprint Masterclass. Please like, share, and subscribe. Identify the disease in child with violet colored rashes over the eyes and on hands. A. Juvenile dermatomyositis. B. Systemic lupus erythematosus. C. Kawasaki disease. D. Hinoch-Schönlein. Here, there is a heliotrope rash on the eyelids. So it is juvenile dermatomyositis. Gauthron's papules are seen in juvenile dermatomyositis. What is the electromyographic change in juvenile dermatomyositis? There is short, small, polyphasic motor unit potentials and fibrillation. Muscle biopsy shows necrosis and inflammation. Now, what are the investigation findings? There will be elevated enzymes, that is creatine kinase, aldolase, SGOT, LDH will be elevated. Alanine aminotransferase is most commonly elevated at initial presentation in juvenile dermatomyositis. ESR is often normal and rheumatoid factor is negative. Anti-nuclear antibody is present in more than 80% of children with juvenile dermatomyositis. Myositis-specific antibodies such as anti-Jo1, anti-Mi2, anti-P155, anti-NXP2 seen on imaging. Muscle biopsy shows evidence of disease activity and chronicity. Electromyography shows signs of myopathy. So the correct answer here is Kawasaki disease. Identify this device used in resuscitator. A. Pulse oximeter. B. NIBP monitor. C. Defibrillator. D. ETC. Here you can see it is a defibrillator. So the correct answer here is C. A 2-month-old baby presented with central cyanosis. With the following findings on chest X-ray, see the chest X-ray carefully, and ECG. What is the most probable diagnosis? The ECG is showing the tall P waves, that is Himalayan P waves, and chest X-ray is showing a box-shaped heart. Box-shaped heart is seen in Epstein anomaly. A. Tetralogy of Fallot. B. Hypoplastic left heart syndrome. C. Coarctation of aorta. D. Epstein anomaly. It is the Epstein anomaly, box-shaped heart and Himalayan P waves. It is seen in Epstein anomaly. The skin lesions shown in the picture are seen in which heart disease? A. Eisenmenger syndrome. D. Rheumatic heart disease. C. Infective endocarditis. D. Heart failure. See the lesions carefully. You can see that the skin lesions are erythema marginatum, and erythema marginatum is seen in rheumatic heart disease. So the correct answer here is B. Rheumatic heart disease. The following X-ray picture is seen in which congenital heart disease? A. TGA, B. TAPVC, C. TOF, and D. Tricuspid atresia. This chest X-ray shows a snowman appearance or figure of eight. You can see a snowman appearance or figure of eight and it is seen in supracardiac TAPVC. So the correct option here is B, TAPVC. Which congenital heart disease is associated with this child condition? A. ASD, B. VSD, C. Patent foramen ovale, D. PD. This child has micronathia and retronathia. The jaw is going backwards, and it is Pierre-Robin's syndrome. In Pierre-Robin syndrome, it is associated with atrial septal defect. So the correct answer here is A, atrial septal defect. Lutem-Bachar syndrome comprises of. Now, what happens in Lutem-Bachar syndrome? There is a combination of mitral stenosis and left to right shunt at the atrial level. Typically, left to right shunt is an atrial septal defect of ostium secundum variety. The four options are A. Ventricular septal defect with aortic stenosis, B. Ruptured sinus of Valsalva aneurysm, C. Atrial septal defect with mitral stenosis, D. Complete common atrioventricular canal. So the correct answer here is atrial septal defect with mitral stenosis. Which of the following condition can be given in the figure be associated with A. Parvo B. Virus infection, B. MDS, C. Down syndrome, D. Fanconi anemia. Child with short stature is there. Dislocated hips are there. Microcephaly is there. Broad nasal base is there. Epicanthal folds are there. Micronathia is there, and thumb defect is there. Abnormal chromosome fragility on exposure to. So it is seen in Fanconi's anemia. The following X-ray finding in skull can be seen as a manifestation of A. Here you can see a crew-cut appearance. It is suggestive of expansion of bone marrow, which is seen in thalassemia. The four options are AML, B. Hereditary spherocytosis, C. G6PD deficiency, D. Thalassemia. So the correct option is D. Thalassemia. Identify the nature of this finding. A. Renal cell carcinoma, B. Hydatid cyst, C. Polycystic kidney, D. Medullary spongiform. It is polycystic kidney. Maximum urine osmolality in a preterm neonate is A 200, B 400, C 500, D 800. Premature infants have an even more limited capacity to concentrate their urine than those born at term, which have maximal osmolality of 500 milliosmol per kg. It is correct answer is C. Please click the link in the description box to join the 2-day ultimate Neet PG breakthrough blueprint. Wishing you all the best. Thanks. Please attend this session live every day at 7 p.m. Wishing you all the best.